Hello everybody, so I'm doing this study with Dr. Val Cheever, and this is the comparison of minimally invasive treatment modalities for post-orthodontic white spot lesions, and we're going to be looking at tooth bleaching, microabrasion, and resin infiltration. So orthodontic treatment is commonly sought after to correct malocclusions and achieve optimal alignment, and thereby improving patient aesthetics. One of the big side effects from orthodontic treatment, especially with fixed appliances, are white spot lesions. These are areas where plaque is accumulated, and that eventually leads to demineralization if the patient hasn't been keeping up with proper oral hygiene. Approximately 50% of people in fixed appliances will develop at least one white spot lesion over the course of treatment. The visual change from white spot lesions is due to the air present and the subsurface porosities causing different refractive indices. The goal of this research is to provide a comprehensive comparative analysis of those minimally invasive treatment modalities for white spot lesions after orthodontic treatment. The treatments compared in the study include tooth bleaching, microabrasion, and resin infiltration, and we'll also explore remineralization therapies to be used in conjunction with those treatment modalities. So here I'm just going to go over the gist of the method of action of these treatment modalities. So with tooth bleaching, it uses high-strength hydrogen peroxide gel, usually anywhere from about 35% to 40%, and that'll produce free radicals that break down the pigmented molecules that cause discoloration in teeth. As for microabrasion, the goal is to mechanically abrade the surface layer of the enamel using an acidic or abrasive paste in a prophy cup. And resin infiltration, you'll use a 15% hydrochloric acid, which you'll apply to enamel, you'll dry it, and then you'll apply a resin infiltrate to hopefully occlude the microporosities that you expose. And then the fluoride and the CPACP, or amorphous calcium phosphate, those are the remineralizing agents to help gain tooth structure back. As for our methods, we just did a thorough literature search through the numerous databases, including PubMed, Google Scholar, Scopus, and the Cochrane Library. Some of our inclusion criteria were publications in peer-reviewed journals, make sure it's written in English, involvement of human subjects with white spot lesions regardless of age or gender, evaluation of minimally invasive treatment options, including but not limited to microabrasion, bleaching, and infiltration, and comparative studies, our randomized control trials, cohort studies, case control studies, and systemic reviews were primarily used. Some of our exclusion criteria were if they're conducted on animal models like extracted animal teeth, if they weren't written in English, were not published in peer-reviewed journals, focused solely on non-minimally invasive treatments, so like composite restorations or veneers, crowns, other full or partial coverage restorations, or they did not include relevant outcomes. And we're still compiling all the articles to be used, so here's some preliminary results. This is a figure taken from a study by Gu et al. Showing change in color of white spot lesions at 0 month, which is T0, 1 month T1, 6 months T6, and 12 months T12. Both of these do show color improvement, but the recovery in the resin infiltration group on the left side has shown better aesthetic outcomes and have lasted longer than microabrasion. And here's a table by Wang et al. Displaying percent changes in white spot lesion area, comparing remineralizing agents to resin infiltration. And as you can see, with a percent change of 46.62, resin infiltration has a much greater resolution of the lesions than other remineralizing agents or just normal saliva. And then another table by Y. Kim et al. Studied the effects of bleaching/remineralization on extracted human premolars, and the color on normal tooth that was bleached compared to a tooth containing a lesion that was bleached have a difference of 3.38 color units. And the general consensus is that the perceivable difference to the eye is 3.7. So it suggests whitening may mask white spot lesions, as that kind of perceivable difference between the lesion and normal tooth will be pretty relatively comparable.